And now to introduce our panel and the panel today, Michael Kaplan is President and CEO of AIDS United, and he has dedicated his career to working for or heading up organizations serving people with HIV/AIDS and the lesbian, gay, bisexual, transgender, and queer community. Please welcome Michael Kaplan.
Good afternoon, everyone. I'm so excited for this panel today. To put a little bit of background to this, I actually tested positive in 1992 in Minneapolis. And back then, I made a conscious decision feeling like there were a lot of folks focused on AIDS and not enough focused on queer youth. And so I started my work in this movement doing queer youth organizing with an organization called District 202. There's a couple friends from here. And boy, the queer movement over those past couple decades, what has been accomplished has been amazing. Whether we think about the senator, the Congress people who have been elected as out gay and lesbian people, ambassadors, appointed trans people in the Obama administration, the don't ask, don't tell, now being able to serve, and to marriage equality. It has been amazing what you and we in the task force have done. What we haven't done is solved AIDS, and we finally have the opportunity to do it, and that's what we're here to talk about today. And my job is to go through a couple slides. I'm going to ask if they'll put the slides up and frame the issue in terms of why we can solve AIDS today, and then we're going to have community perspectives talk about, from their perspectives, programs that are happening, challenges we're seeing, and where we can go forward. And so the panelists will be just making sure you're listening. The panelists will be Elicia Gonzales from Galé, and raise your hand. Charles Stevens from Emory. Cecilia Chung from the Transgender Law Center. And last but never least, Phill Wilson from the Black AIDS Institute. And if I could get my first and second slide up, I have a cue and one more. I put the slide up to think about where we are in this epidemic. And how many people here were born post-1981? Let me hear from voice, post-1981 birth. So for your lives, HIV has been there, and for much of all of our lives, the narrative has remained the same, and that's why I wanted this quote here. The narrative and the reality of AIDS has been, look, it's substantially gay, bisexual, men who have sex with men, and it's predominantly driven in communities that face so many other harsh challenges, whether it's struggling with substance abuse, whether it's trans identity, whether it's communities of color. And that narrative hasn't changed. But what has changed is we now have the science to end this epidemic. And I want to take you through what that looks like. The next slide you'll see up is just a quick look at what the epidemic over 30 years has looked like. And what's key for you to see here is we've just sort of gone straight line, except in the mid-90s when deaths caught up to new infections, and then we stopped deaths or cut them in half with active retroviral treatments. But we continue flatline with about 40 to 50,000 new infections each year. And this is what it looks like. Those top three bars that are all in color, those are gay, bisexual men who have sex with men. And every year, in 365 days, we're seeing 28,000 gay, bisexual men infected. And if you think about the sizes of communities, the disparities are huge, particularly in communities of color. And I want to put that in context. If we have 4,000 people in this conference, that means everyone at this conference times 7, each 365 days getting infected with HIV. There is no community greater impacted than gay, bisexual men who have sex with men, transgender communities. Just another way of looking at this, I put a slide that shows the epidemic is 2/3 among gay, bisexual men. So what's changed? Well, there's a number of things that changed. We have a new framework for HIV and why we can end this epidemic. The first is that we have the Affordable Care Act that passed in 2010. Incredible. We got the National HIV/AIDS Strategy for the first time. We got treatment as prevention, and that's huge, and I'm going to take a little more time to talk about that. We got an understanding of where we are in the treatment cascade, and I'll talk about that. And we got pre-exposure prophylaxis, and finally, we got full implementation of the Affordable Care Act. So in 2011, Science magazine declared Breakthrough of the Year, the finding by the National Institutes of Health, the idea of treatment as prevention. And the idea that treatment is no longer just about me and my brothers and sisters who are infected, but it's also about stopping transmission. A quick kind of look at the data and what they found is that they looked at 1,700 couples in Africa, Asia, and North America, predominantly heterosexual, but many of us believe this translates to gay communities. And they did two arms. One of people who were prescribed treatment right away, and the other who were asked to wait until their T cells hit 250. In the arm in which treatment was prescribed right away, one singular infection was transmitted that they could link to their partner. And that one singular infection was before the treatment had built up in the partner's system. And in the other arm, 27 infections were transmitted, showing a 96% reduction. So this is huge. It truly shows us we can stop transmission simply through treatment as prevention. But what's the challenge? And I'll go real quick through the treatment cascade. We talk about this a lot in our field. If I can get the next slide. And the first question is, so what do we have in the US? We have 1.1 million people infected with HIV. And right off the bat, we've lost 20% of them. They don't know they're infected, they don't know their status, and you can bet 2/3 of them are gay, bisexual, men who have sex med, and transgender. And then you go to the next column in terms of linked to care and retained in care, and between those two, we're losing 400,000 to 500,000 people. And that has to do with so many things. It has to do with stigma. When our community talks about clean, is those not infected, and me being infected means I'm dirty. How do I want to deal with going into care? When we don't have culturally competent services, how does it impact care? And so we can change those, but that's the challenge. Finally, we got 36% on treatment and 28% virally suppressed. And so here's the challenge for all of us. When we get that last bar up to 100% and all the other bars accordingly, we go from the 50,000 infections that are predominantly in our communities down to less than a few thousand. And it's by case finding, treatment, and knowing that. But we also have some options for people who are not infected, and that's around pre-exposure prophylaxis. In 2012, we learned that through one pill a day for those uninfected but at high risk, we can reduce the likelihood of them getting infected anywhere from 50 to 90%. And that's really huge, and the variable is about how well they adhere to treatment. Yet today in the US, we have less than 2,000 people using PrEP. We have 27,000 gay, bisexual men getting infected and only 2,000 using PrEP, and we can do better. The last piece that changed the whole world in terms of understanding why we can change this epidemic is the Affordable Care Act. For the first time, I can get insurance this year. We're no longer discriminated against. Our policies cannot be taken away. We have a baseline of health benefits that include pharmaceuticals, and we have the drive to expand Medicaid, and a good half of the country that's already doing it, and that's critical in that HIV not only affects our communities, but more importantly, or equally importantly, it directly parallels poverty and those lacking resources, and Medicaid is critical to solving that. So my last slide I'm going to take us through is two things, and to tell you, in 2011, CDC declared HIV a winnable battle, and the National HIV/AIDS Strategy set out a vision in which every new infections would be few and far between, and that people would have access to treatment, and we would have particular attention to the disparities that exist there. We have a government framework to get us to the end of the AIDS, but government won't do it. CDC declaring it won't do it. It's reliant on community. It's reliant on us changing our community norms, building our political will, talking to our brothers and sisters about testing, about PrEP, about treatment. And that's why I'm so excited to now move to a panel of community perspectives. And so for our first panelist, Elicia.
Good afternoon, y'all. My name is Elicia Gonzales. I am the director of GALE. And before I get started, I just want to call out all of my Philadelphia people that are in the house. Where's Philadelphia? Okay. Where are my queer Latinos? Okay. I just had to do a little room pulse check. So before I move into the actual conversation, I wanted to just do a quick poll of the audience. Raise your hand if you have ever spoken, said, or have heard that Latinos are homophobic. Raise your hand and look around. Okay, so that's a lot of folks with that notion in our minds, and I'm going to tell us why we need to stop thinking that. So for the first slide, I'm going to tell you a little bit about GALE. GALE used to stand for the Gay and Lesbian Latino AIDS Education Initiative, GALE. We've since dropped that acronym and have just since now moved to GALE, a queer Latino social justice organization, right? So recognizing that HIV, although important in our communities, does not exist in a vacuum, and that there's all these other social determinants that impact our communities and our lives. So we are unapologetically Latino, we are unapologetically queer, recognizing that Latino is not who we serve, but how we serve, right? So as Latinos, we are multicultural, we are multiracial, we are multilingual, and we recognize the need for familia, right? So at GALE, the folks who work at GALE, the folks who come through the doors, we're all part of the larger familia. So when you walk in through the door, no matter if you're white, black, brown, purple, yellow, straight, gay, what have you, you're gonna be treated with respect and dignity, okay? All of our services that we offer are free, confidential, offered in both English and Spanish and Portuguese. And so we welcome people to come to get services, but more so to be part of the family, right? So a second ago, I asked you to raise your hands if you had heard that Latinos are homophobic, right? So we set out to do a campaign that was sponsored by the city of Philadelphia. And at the time, I didn't know that it was the first ever campaign of the kind in the city. And people have also said it was the first campaign of its kind in the country. And had I known that, I probably would have not done it because I would have been too nervous to proceed. But we went ahead and we did this survey called Positivo. So if anybody has heard of Positivo, clap your hands because it'll make me feel good. So later on throughout the day, we'll have Positivo cards ready for everybody to look at. But we did a campaign called Positivo, and when we wrote the proposal to the city, we said, we're gonna do a campaign to reduce stigma in the Latino community based on the assumption that Latinos are homophobic and that we don't like gay people in our community. So we did this campaign, and what we found out was that in actuality, Latinos are far more affirming of both gay people and HIV positive people than is being told, right? So when everybody is raising their hands, I want you to take the pledge to then raise your hand and say that you're gonna stop that lie, because it is a lie, and in fact, it's racist, right? So what we learned is that Latinos embrace each other regardless of who we are, right? So we might hear like, well, I don't agree with the fact that you're gay, or, oh, like I can't have my grandchildren now, right? But I accept you because you're my son. I accept you because you're my daughter. And we found that by and large across the communities that we surveyed, which is that they don't necessarily understand it somehow, and they are afraid for their folks who come, who are HIV positive, but that by and large, they are very embracing. So I want us today to create the change of stopping that racist lie, right? Because to say that Latinos are somehow homophobic is somehow implying that we're not sophisticated enough to grasp the concept of homosexuality or of HIV, right? So it has to stop. And you guys are really the ambassadors of truth, right? So your challenge is to leave here and to not ever say that again. So the other thing that you can do in terms of taking action, because it's not just enough to come here, meet people, maybe hook up or whatever, but to also take action, right? So I would encourage you all to go to the Galay Philly website to check out more about the Positivo stories, which highlight Philadelphia Latinos, right, of mixed status, so we didn't ask folks to disclose their status, of mixed status, but who look like you, who look like they could be your grandma, who look like they could be your brother, your sister, right? And we would ask you to interact with those stories, and more importantly, to tell your own story, right? We all have a story of being affirmed by somebody who we love in our family, in our community, and that story is not being told, right? So our story is being told by people who don't know the truth. So go to the Galay Philly Facebook page. We're on Instagram, Twitter, like the whole thing, Grindr, and it's just for research. So we want to make sure that you guys are uploading and telling your truth and helping us, spread the truth of being Positivo. So be proud, be who you are, and recognize that Latinos are affirming of our communities. So thank you.
I want to open my remarks by invoking some of the names of the first wave of Black, queer, male HIV/AIDS activists. These Black, queer feminist men in the 1980s who put their voices, bodies, and lives on the line and became, in the process, casualties of war. Craig Harris, Donald Woods, Joseph Beam, Tony Daniels, Essex Hemphill, Marlon Riggs. These men made my voice and other voices of my generation possible. I want to offer a series of questions and framing strategies to help us grapple together with the impact of HIV among Black, gay, and bisexual men in the South, and particularly young Black, gay, and bisexual men. The first issue I want us to consider is leadership. There has to be capacity building investment in the South, particularly for the new wave of young Black, gay, and bisexual male leaders, not merely preparing them to be middle managers in large bureaucracy, nameless and faceless cogs are perpetually tethered to outreach worker jobs, but thought leaders, social entrepreneurs, senior and executive leaders, and innovators. We must invest not only in HIV prevention as it relates to condoms and pills, but also leadership. Second, cultural production. We have to make culture a part of our HIV and AIDS work. There is no culture without our stories, and there is no resilience without our culture. Our resilience is thus rooted in the passing down of our stories. Our poets, storytellers, artists, musicians, dancers have to be brought back into HIV and AIDS activism. Third, supporting media activism. We have to mobilize young Black, gay, and bisexual men to both lead the public narratives that are being created about them and counter those narratives that ring false. We must channel and unleash with the full force the institutional and philanthropic support for online Black queer youth activism. Some of our most brilliant commenters and cultural critics are tweeting and Facebook status updating. How do we support and sustain those voices? Fourth, state-based advocacy. There are state legislatures in the South that are effectively killing young Black, gay, and bisexual men. There are bills written with the blood of our youth, legislation enshrined atop their bodies. We must seize this moment and create opportunities to train and mobilize young Black, gay, and bisexual men to engage in state-based advocacy. And as a part of our state-based efforts, we must find ways to engage in Medicaid expansion, advocacy, certainly, but also build coalitions with folks doing work around voting rights, reproductive justice, economic justice, marriage equality, and other progressive issues. Finally, the most radical thing we can do is to ask ourselves, what kind of communities do we want for young Black, gay, and bisexual men, particularly in the South? Do we want communities where femophobia and fat shaming are normalized and incentivized? Do we want communities where young Black, gay, and bisexual men feel most valued when they're sexualized and assimilate into dominant notions of gender and body expression? Do we want communities where there is no movement history and no collective memory? Do we want communities where young Black, gay, and bisexual men learn about sexual risk and danger before they learn about intimacy, pleasure, and agency? Or do we want communities where young Black, gay, and bisexual men are seen as full and complex human beings, where they have an environment where they can thrive as leaders? Perhaps the most urgent and really the most radical question we can ask ourselves and each other is, how do we co-create an environment where young Black, gay, and bisexual men can be free? Thank you.
Hi, good afternoon, everybody. And again, I'm Cecilia Chung from the Transgender Law Center. And I'm also the current president of the United States Phill HIV Caucus. It's a coalition of networks of people living with HIV. And I have been tested positive since 1993. And this work means my life in many ways. And I think that when you hear my colleague speaks about inequalities and speaks about the urgency to really change the face of the epidemic, we also have to look at the issues of what caused these epidemics to be so rampant. And so I'm here to give you the answer. We talk a lot about inequality, and we talk a lot, and maybe you've heard Laverne's keynote on Thursday night, or Bambi's speech yesterday. A lot of it is driven structurally. So structural violence is just as impactful to our lives as direct physical violence. Unfortunately, these are not unfamiliar topics to most of us in the community. And imagine if every single day somebody tells you you're not good enough. We don't want you. You are an outcast. Slowly and surely, you will start believing that. And that's what happens when there's stigma, when there's discriminations, and when there is this whole moralistic values to judge as if somebody else's behavior is better than ours. So in the trans community, coming from the Transgender Law Center, I assume I have to talk about the trans community. That in 2009, there is a research that shows that HIV prevalence in the community was about 2.6% compared to 0.9% for men and 0.3% for women in the United States general populations. And the highest percentage, surprise, surprise, is in Black trans women, and their prevalence rate is 4.4%, while trans Latinas is 2.5%. HIV is even higher amongst trans women of color 15 to 25, according to one study, and its estimated rate of 19% to 22%. Structural violence. What's structural violence? When we look at structural violence, it's easy for us to think about discriminations and stigma, but it's also about not getting employed and not getting housing. So trans women are 4 times more likely than general populations to have a household income of less than $10,000 per year. Unemployment among trans people of color is more than 4 times the national average. And according to in other studies, 1 in 5 transgender people have been homeless, and young minority trans women, and this is a study that's done in Chicago and LA, are 67% more likely to have involved in sex work and drug use. Those are pretty alarming numbers. So as we can see, structural violence is a huge cause to why people have limited choice. When you have limited choice, you are more at risk of getting a poorer health outcomes. So employment is healthcare. Housing is healthcare. We've also heard about the treatment cascade. In San Francisco, we recently had released some data on the treatment cascades amongst trans women who are living with HIV. And it seems like that trend continues, that it has a poor outcome amongst trans women living with HIV, even in a city like San Francisco. So imagine what it's like in the South and in other rural cities where the structural violence are rampant. So what can we do about that? We have a great administrations who are really supportive of LGBT rights and who are very supportive in looking at all these intersectionalities. So it was just last year that President Obama signed into law the Violence Against Women Act that is trans inclusive. And it gets us to really start looking at the intersectionality between violence, relationship-related violence, gender-based violence, and HIV. And it really helps us to know how we can set the bar to work towards an AIDS-free generations. But we cannot do that without your help. We have to change that dialogue. We have to create a positive environment where none of us are judged because of who we are, who we love, or how we want to choose to treat our bodies. It's a very feminist thing to think about it. So it's all about feminist movement that hold core principles of body sovereignty. So, and with that, we have to also expand on who we have to look at to build these coalitions. People who've used drugs, for example, they have always been there as part of this community, but we don't talk about it. We like keeping that as a dirty secret. But if people actually have a life that they can walk in the light, then they wouldn't have to do any of that in the shadow. That's why drug policy reform is part of HIV prevention. Thank you.
Good afternoon. My name is Phill Wilson, and I'm the president and CEO. Of the Black AIDS Institute. The mission of the Institute is to end the epidemic in Black communities by engaging and mobilizing traditional Black leaders, institutions, and individuals in efforts to confront HIV and AIDS. We do training and capacity building, we do communications, but most importantly, we do mobilization and advocacy from a uniquely and unapologetically Black point of view. I want to thank the task force and Michael and everyone who was involved in putting together this plenary. This is an important discussion for us to have. I have a question. How many of you, by voice count, believe that this community is greater than AIDS? That's good, because we are at a deciding moment in the trajectory of the AIDS epidemic. We have the tools to end the epidemic in this country, but let's be clear. Having the ability to do something is not the same as doing it. The AIDS epidemic challenges the LGBT community to decide who we are. 1 in 5 gay men in major U.S. cities, without regard to race, is HIV positive, and many of them don't know it. Young Black gay men in the United States have the highest rate of HIV infection on the planet, full stop. We have unfinished business. I still get calls, early morning calls, middle of the day calls, late night calls, calls from mothers who've just found out that their sons are HIV positive and they're still reeling from the grief and the guilt of having a son who's HIV positive. I get calls from newly diagnosed young men who didn't know that they were at risk, don't know what to do, and or don't believe their lives are worth protecting or saving. Often they are more afraid of the stigma than they are of the disease. And not just stigma from straight folks, but from stigma that happens inside this community. There are men in this room who are HIV positive and are afraid to disclose their HIV status because they're afraid of rejection. That stigma prohibits them from getting tested. That stigma creates a barrier for them getting engaged in testing. When that stigma exists, it becomes difficult for folks to adhere or stay in treatment. If that stigma continues, we will never reach viral suppression and we will never end the epidemic. That can't be who we are. That can't be who we are. We all know the power of coming out. The Black AIDS Institute is starting an HIV coming out initiative called Positively Out. And we need each of you to join us. We need to create an environment when people living with HIV feel free to come out and to live their lives free of rejection and discrimination. And every one of us living with HIV needs to begin our personal journey to live our lives out loud. Our families, our friends, and our communities, they cannot love us, they cannot support us if they do not know us. I've lived my entire adult life with HIV. I personify what can happen when people with HIV have the love and support of family and friends and the care and treatment we need and deserve. I am a living example of what can happen when we claim our rightful place in our communities. I call on all of us to do that because coming out is essential to end the epidemic in our communities. Audre Lorde said, "When we speak, we are afraid. Our words will not be heard or welcome. But when we are silent, we are still afraid. So it's better to speak, remembering we were never meant to survive." It was true 20 years ago, and it's true today. Silence equals death. In 1996, my doctors called my mother in Chicago to tell her that I had less than 24 hours to live. I was in the intensive care unit at Kaiser Permanente Hospital in Los Angeles. Thanks to the new treatments, by 1998, I was running marathons. In October of 2000, I entered the Marine Corps Marathon in Washington, D.C. I knew it was going to be a difficult race, but I had trained hard and I was ready. Now back then, mile 20 of the marathon was near the Lincoln Memorial and near where the Martin Luther King Memorial is today. As I approached the marker, I looked up to my right to see the Lincoln Memorial, and I collapsed. I was rushed to the emergency room and nearly died again. One morning, during the International AIDS Conference in 2012, I decided to visit the MLK Memorial. And as I was leaving, I looked up to the right, and I saw the Lincoln Monument again. And I began to walk, and I found myself walking past the monument. I ended up walking 6 miles. After 12 years, I finally finished the race. The LGBT community has made great progress toward achieving equality and justice for queer folks in America. But you know, justice cannot mean just us. We are part of an enormous mosaic. We are connected. We are essential. Through our link to each other, we make this entire rich, wonderful, beautiful, and complicated design more profound. We make it more just. I've always known that AIDS was a marathon and not a sprint. We do have the tools to create an AIDS-free generation, but it cannot happen without the LGBT community, because we are the soul and the spirit and the spark of this movement, of this fight. I've been talking a long time about a recurring dream that I have. In the dream, there's a little boy who asks a wise old woman, "What did you do during the plague years? What did you do when you had a chance to end the AIDS epidemic? Did you speak out?" I always wake up before the wise old woman has a chance to answer. I'm afraid I wake up because I'm afraid of the answer. I'm afraid the answer will be not enough. I'm afraid the answer will be that we did not speak out. As much as we might not want it to be, AIDS will be a part of our struggle as long as any of us are struggling with HIV/AIDS. We have to speak out. We have to finish the business. We have to finish the race, because that is who we are. The day will come when this epidemic is over, and when it does, it's important for them to know that we were not all monsters, that we were not all cowards, that some of us dared to care in the face of it, some of us dared to fight because of it, and some of us dared to love in spite of it. Because it is in the caring and the fighting and the loving that we live forever.
We're going to continue the conversation. Is this mic on? I will. Now it's on. Great. We're going to continue the conversation. We have a few minutes for some questions that were submitted online and through Twitter, through hashtag CC14N8. And if you have questions you want to submit, still do them, because the panel and Phill will all work together to try to get answers afterwards. So I'm going to take one of the questions that came in. In fact, I'm going to direct this to Elicia, and this is from HIV Prevention Justice. And the question was, yes, what do you think the impact could be with CDC changing the term from unprotected sex to sex without condoms?
I think it's a great question. Julie David, we know you sent that question in. I think it's a great question because it frames the need for sex-positive messaging. I think that we have done a really terrible thing, honestly, within the HIV movement to pathologize and to demonize our behavior. And I think queer sex in particular, we're not allowed to be sexual. We're not allowed to have the kind of sex that we want to have, right? We're seen as sort of immoral and sick and sinful. And I think using language like unprotected versus protected implies that you're somehow responsible or irresponsible if you're not taking these actions as though you're a monster, right? And I think it's in the same lines of the dirty versus clean mentality. So I think that there's a lot to be said about having the CDC be more sex positive. And at Galay, we always say that everybody has the right to have both a healthy and pleasurable sex life, no matter their HIV status, your sexual orientation, or your gender identity.
Well, I'm gonna, do I need to push something? Yeah. Okay. And I want to tag onto that for a second, and then I have a separate question, which is, we often think when you say sex without condoms is unprotected sex, you erase the reality that when I'm fully virally suppressed,
right,
that is protective sex.
Right.
That when I decide to do pre-exposure prophylaxis, that is protective sex. And that a condom in and of itself is not the only thing we can be doing in our community for protective sex.
And
Absolutely.
that both of those strategies, when used properly and effectively, are as protective as condoms.
Exactly. I'm going to target the next question to Cecilia, and this was submitted, which is, data suggests that 1 in 2 trans women will become HIV positive in their lifetime. How are we addressing that?
I think that, personally, I don't think that that's a complete sentence.
So I think that the complete sentence would look like this, like, with this trajectory of inequality continue to exist, trans women will face a higher likelihood, or 1 in 2 trans women will face a higher likelihood to be HIV positive. And that speaks to really the structural inequality in our systems. And I was joking in a serious way with a friend of mine, Laura Thomas, are you in the room? Like that if there is an oppression Olympics, the trophy would be extreme poor health outcomes or even death. If we look at why young Black gay men or why young trans women of color are more likely to be infected, that's part of the answer. And with structural violence, it's different from a car accident or you accidentally cut your finger. It can be prevented. When we talk about prevention, HIV prevention needs to also remind us how to prevent inequality from happening. So there are a lot of programs out there right now trying to change the cause of it, but I think nothing would be as effective as economic empowerment, as well as leadership development. And with that, I think we will all have a fair chance to have a productive life and not live in the shadows and be able to be our true self. Laverne says love is revolutionary. Right. Unconditional love is life-saving.
Thank you. I'm going to do one last question. We need to be done just a minute before the clock runs out for a couple announcements, but I'm going to ask both Phill and for Charles to talk about this. I've heard the statistic in some major urban areas, a Black man has a 1 in 2 chance by the age of 50 that they're going to be HIV positive. And for Black gay youth, the rates of infection are alarming and growing. What is it we need to be changing, and what are the barriers we're facing in terms of success?
Well, the first thing we need to understand is what's not true. And what's not true is that Black men, young or otherwise, are behaving in riskier behaviors than their counterparts. Now, the data shows, and it's not helpful to perpetuate that myth. In fact, it contributes to the problem. The data shows, in fact, that Black gay men engage in less risky behavior, sorry about using that phrase, but less risky behavior than their counterparts. So the challenge, quite frankly, is to develop, I think Charles answered the question in his talk. It's about leadership, it's about support, it's about making sure we're breaking down the barriers for access to care.
What I would offer is that I'm not even sure if we're in a place to be trying to figure out answers. I think we need to get better questions. Questions like, what are we doing right? Questions like, how are we protecting ourselves now? Questions like, what do we really know? I mean, I think just on the sex positive vibe, I mean, 30 plus years after HIV first entered public imagination, there's so much we don't know about anal sex. There's so much we don't understand about desire and romance and loneliness and despair and all of these very real issues that young Black gay men face. And I think the starting point is to really start asking better questions to get us to better, to possibly better answers down the road.
Thank you. I have a couple of logistic pieces and closeout pieces, but before we do that, I want to give the panel a round of applause and thank you so much. I want to be very clear. This has been a very long conversation. We're 3 decades in. This is not the middle. This is absolutely not the end point. But this is revamping the conversation. For those who are interested in continuing the discussion here at Creating Change in terms of the LGBT movement and HIV and AIDS, I would invite folks to join us in the General Ballroom D, Level 4, immediately after here, where Francisco Ruiz from CDC, along with Liam Cabal and Rob Banaszak from AIDS United, will be leading a discussion. And then the last thing is I got my cell phone out, and I want you all to take your cell phone out as well. And I want you to open up your texting application, and I'll explain why. Right now in the US, criminalization of HIV is a major issue. It is a deterrent to people knowing their status, where simply knowing you were positive and not disclosing can result in decades of lockup even though you may have been fully virally suppressed, wearing a condom, and never transmitted, you are at risk in many, many states. At the federal level, we are grateful for Congresswoman Barbara Lee, who has started legislation called the Repeal Act, which would really push to look at HIV criminal legislation. And so what I need each of you to do is to create a new message, and we want you to send this message to the number 69866. And then in the message line, and I'm doing this slow because I'm counting on y'all doing this, I want you to type in the word repeal, R-E-P-E-A-L. Make sure you hit send. Shortly, at some point, you should be getting a response message asking for your zip code so that they can sign you on to a petition so that people from your jurisdictions can know you're supporting this, and you can help us change the laws that's criminalizing and stigmatizing HIV. And last but not least, one more round of applause for the whole panel and your participation.
What's the number again?
The number again, 69866, and the message is repeal. Thank you.